7 things you should know from your dentist. The link between mouth and body health is bigger than you might think. A better strategy would be to put your health first rather than your money. There's rising awareness that we cannot expect a healthy body if we disregard our mouths. Dr. Brittany Seymour, an associate professor of oral health policy and epidemiology at the Harvard School of Dental Medicine, estimates that almost 300 diseases and ailments are connected to oral health in some manner. These connections might cause problems or exacerbate existing ones. In a nationally representative 2017 survey of over 2,100 individuals between the ages of 50 and 64, it was discovered that over 1/3 had experienced dental issues in the previous 2 years that resulted in them missing work or experiencing pain, difficulties eating, or other health issues. Approximately 2/3 had received preventative dental treatment in the previous year, but over a quarter had not done so in at least 3 years. The idea that oral health issues are limited to the mouth and that we can ignore them persists. Dr. Seymour, who serves as a national spokesperson for the American Dental Association, states, "We know that's not the case. There's still a lack of awareness around the importance of oral health far beyond the way we look." Risks associated with gum disease. Indeed, the long-term consequences of poor oral hygiene can be far more detrimental than the odd cavity. From the mouth, pathogenic germs and inflammation can enter the bloodstream and spread to various parts of the body. The heart is especially susceptible. Expanding upon previous research showing a correlation between poor oral health, gum disease, tooth loss, etc., and an increased risk of heart attacks, a recent study takes one step further. The investigation, which was released on August 1, 2022, in the Journal of the American Dental Association, discovered that patients with heart attacks who had not received dental care during the previous year spent more time in the hospital than patients who had received dental care. Meanwhile, better gum care could cut consequences including kidney, nerve, and eye damage by roughly 20% in diabetics with periodontitis, severe inflammation of the gums and the bones that support the teeth. This estimate came from a 2020 study published in the journal Diabetes Care. According to Dr. Seymour, the prevalence of periodontitis is 3 times higher in those with diabetes. Moreover, uncontrolled gum disease usually makes blood sugar regulation more difficult for the sufferer. Early warning signs of diabetes can even show up in the mouth, she claims. These include dry mouth, gum disease, changes in taste, slower healing of cuts or sores in the mouth, and mouth infections such as thrush. Products for oral hygiene. What is truly necessary? Selecting mouthwash, toothpaste, and other dental care items used to be very easy. However, the array of goods competing for our teeth and pocketbooks has blossomed into an oral care market worth $49 billion, which is projected to almost treble by 2030. But modern products offer more than just keeping our lips fresh and minty clean. These products, which occupy entire aisles in supermarkets and pharmacies, range from gum repair, toothpaste, to plaque removal mouthwash, and their claims can be perplexing and upsetting to us. Options are fantastic until there become too many to choose from and people start to doubt their decisions. It is wise to have doubts. Plaque removal, for instance, calls for some sort of mechanical procedure like flossing or brushing. Accordingly, a mouthwash designed to remove plaque might eliminate germs, but it might not necessarily get rid of detritus. Similar to most toothpastes, gum repair toothpaste incorporates stannous fluoride as its active ingredient, which has antibacterial qualities. It is promoted to lessen gum bleeding and inflammation associated with gingivitis. It's possible that gum-healing toothpaste functions the same way as other toothpastes with this kind of fluoride, or even better. When in doubt, check packaging for the American Dental Association's ADA seal of acceptance. The seal indicates that the product has undergone independent evaluation by a group of dentists to confirm that it accomplishes what it claims to do. It's impossible for me to distinguish between patients' lips based just on the products they use. Finding a regimen that works for you is really all that matters. Here's where product selection can be useful. You can experiment with numerous possibilities until you find something that helps you keep up those positive routines. More disclosures. Regarding dental health, what else can surprise you? 6 more nuggets from Dr. Seymour. 1. It's not always preferable to brush longer or harder. Although choosing an electric toothbrush or one with more bristles is a matter of taste, abrasive toothbrushes don't help your gums or teeth get any whiter. Generally speaking, brush for at least 2 minutes twice a day. Technique is more important than rigor, she claims. If your technique is effective, 2 minutes is just as effective as 5. For advice on the best brushing technique, consult your dentist. 2. While cleaning in between teeth is not required, flossing is. Although some individuals dislike dental floss, there are other ways to clean in between teeth, where plaque and debris can lurk. Cavities and irritated gums might result from skipping this important step. Those who detest floss might try floss picks, which are tiny pieces of floss twisted between plastic prongs. A tiny cylindrical brush called an interdental cleaner or an oral irrigator like water pick are other choices. In the end, interproximal cleansing is important. We can identify which patients do it and which don't. Ask any dentist. 3. Not only does your dentist examine your teeth and gums, but she also does a cancer screening. In the course of routine examinations, dentists are taught to search for head and neck cancers. In order to check for lumps or enlarged lymph nodes, this usually entails pressing on your neck, chin, and jaw. She will also spread out your cheeks to examine your tongue, mouth, and throat for any unusual areas. Each year, head and neck cancer affects 66,000 Americans and claims 15,000 lives. 4. Consultation with a dentist is advised during pregnancy. Pregnant women are advised not to receive dental care, particularly dental x-rays, according to a persistent but long disproven fallacy. However, with preventive treatment, an issue can be caught early before it worsens and becomes an infection or cavity that needs to be filled. A medical evaluation is necessary for the various oral changes that pregnancy brings on, including bleeding gums. Verify whether these are typical alterations that will go away after birth, or whether they are indicators that require more urgent care. 5. Menopause can have oral health effects. The decrease in salivary flow brought on by the menopause-related decrease in estrogen and progesterone can lead to dry mouth, which exacerbates tooth decay and infection. Falling estrogen levels also increases the incidence of gum inflammation and discomfort, gingivitis. And finally, note that gum without sugar cannot be chewed in place of brushing. Chewing gum stimulates the production of saliva, which helps remove acids from meals and beverages before they damage tooth enamel. This effect can be strengthened by gum containing the artificial sweetener xylitol, which reduces the amount of bacteria in saliva that cause decay. However, these advantages do not outweigh the necessity of brushing twice a day. While gum may help loosen stuck-on food particles, brushing is still the most efficient way to get rid of plaque. We care about your general health, so please subscribe to our channel for more health tips. Leave your comment and likes. Thank you. WiseWORLD HealthCare.